Hi guys, welcome back to my channel. My name is Claire Ucherike, and in today's video I'll be talking about malaria in pregnancy. I'll be telling you all about the drugs that you usually use when you have malaria and you're pregnant. I'll be talking about ways of preventing malaria when you are pregnant. So please share this video with anyone who is pregnant or planning to get pregnant. So if you're ready, let's jump right into the video of today. Firstly, as we know that malaria is caused by the bite of an infected female Anopheles mosquito. So if you're a woman, then you should prevent mosquito bites. How can you prevent mosquito bites? By wearing long sleeves, long trousers, especially in the evening when you have to sit in the parlor to watch a movie or read a book. And then secondly, you should sleep under long-lasting insecticide treated mosquito nets. And if by any means your mosquito net is torn, you can sew it up, especially if it's a new one and then it's torn. Sew it up so that the mosquito doesn't pass through the openings to bite you. Next thing you can do is, whenever you are going out, the whole family is going out, you can use an insecticide so that it will reduce the mosquito in the house. Now, it's also important to clean up your environment. If you have a body of water, like a bucket of water, or you store water in big baths, then you should cover them. Or if you have dirty gutters around your house, then you should clean them up, because these can serve as a breeding ground for mosquitoes. So there's no point you're sleeping under nets but your environment is still dirty. It's like 1 in as in plus 1 minus 1. Yes, that's just the best way to describe it. So please, if you're pregnant, it's also important not to travel to endemic countries where the prevalence of malaria is high. You should avoid such places. And then in the evenings, you don't need to use perfumes, because there are some perfumes that attract the mosquito to you. Now, why should you prevent malaria in pregnancy? Because it can lead to neonatal deaths, and it can also lead to severe anemia in the mother and in the unborn child. Some people may experience spontaneous abortion, stillbirth, low birth weight, intrauterine growth retardation. That's when the baby is not growing well in the uterus. So please, when next you're in the clinic for your antenatal care and you're giving your sulphadoxine-pyrimethamine, that's the drug used for intermittent preventive therapy, you should take the 3 tablets at once. You should not space them, take one in the morning, one night. No, 3 at once, and take plenty water. Those of us that don't like water, it's very important to drink water when you take fansidar, sulphadoxine-pyrimethamine. That's the brand name. So take lots of water, and if you know that you react to sulfur drugs, please inform your doctor, because they don't know it all. You are the one, you should be the master of your health. Tell your doctor, I react to sulfur drugs like Septrin. If I take Septrin, you just explain what you experience whenever you take sulfur containing drugs, so that an alternative measure can be used in your own case. Now, when you take fansidar, it's also important to avoid direct exposure to the sun. You may experience some side effects like rashes, vomiting, fatigue, that's the feeling of tiredness, headache, itching. Please, these are just side effects, and with time they wear off. But if you experience shortness of breath or sore throat, then please go back to your prescriber and inform whoever prescribed the drug for you. It's also important to note that folic acid, which is used in the routine care for pregnant women, is very beneficial. Yes, we all know it's very beneficial. It helps in the development of the child's brain, the skull of the child, and the spinal cord of the child. And if you don't take enough folic acid when you're pregnant, the child may come down with neural tube defects. But when you're taking your SP, that's your sulphadoxine-pyrimethamine, it's advisable to have an interval of about a week. That is, don't take your folic acid with your fansidar, because folic acid, which is very beneficial in the pregnant woman, can affect the efficacy of your sulphadoxine-pyrimethamine. Your sulphadoxine-pyrimethamine is an antifolate. So when you're taking folic acid, it's like you're countering the effects of the sulphadoxine-pyrimethamine. I hope this video has added value to you, and if it has, then please share, like, and subscribe. Please subscribe. Don't forget to subscribe. See you in the next one. Until then, stay healthy. It's your girl, your clinical pharmacist, signing out. Take care. Bye.